Hello, everyone. My name is Amol Nirgudkar. I'm the CEO of Prism. And I have with me here two of my friends from DSO Hygiene Excellence, Christine Diehl and Sarah Varney. And our topics today are about optimizing hygiene departments and DSOs. And this question directly, I think every DSO, every hygienist at every DSO or any other place wants to think about how do we turn our hygienists into these powerhouse producers. Sarah, tell us a little bit about that. What are the important things that you need to engage with your hygienists from a communication standpoint so that they understand that production is important, and how do they become great producers?
Yeah, and I think right when you said that, I can think of a few powerhouse producers that came to mind. I think they do have a lot of things in common, and it is some synergy with the doctor, right? There is great communication between the doctor and the hygienist. They have mutual respect for each other. They have mutual care for the patient and the practice, right? They're invested, they're engaged. The doctor is believing in them. The hygienist stands behind the doctor and the practice 100%, and that just creates a really electric environment. I think powerhouse hygienists come out of that. I think the things that occur when you have that very highly energetic situation is that the hygienists are very aware of what they're accountable for in their hygiene departments, right? You have that communication. You both want the same things for the patient and the practice between the doctor and the hygienist. They understand how they're being really monitored. I don't want to say it's kind of a bad word, but it is how are you being held accountable to what's happening in the hygiene department? They understand the expectations. So I think the numbers and the production at the end of the day are just a reflection of the relationship that the hygienist has with the doctor and with the patients, right? Powerhouse hygienists that are great producers, they have built great relationships, with the doctors, with the team. The team's all willing to fill their schedule, they see the hygienist downtime. They've built a relationship and trust, and the front desk, we have assistants that jump in and will fill our schedule for us if we're busy. They know that we want to see patients, we want to get people in. We have that team environment within our office. And it's a team effort to have a powerhouse hygienist. It's not your hygienist doing it alone. And if you're making her do it by herself, it's failure, right? You need the doctor behind her, you need the team behind her. You need to have the expectations there in place. She needs to be building great relationships with the patient and great trust, and just providing optimal care to the patient.
It's interesting. So I mean, it's the conversation is challenging, right, Christine? Is that we're not really talking about, we want to make them powerhouse producers, but not just for the sake of becoming powerhouse producers. It's really what conversations do you need to have with the hygienist about, hey, you need to produce 1,500 today? That's not the conversation you need to have. Is how do you get them comfortable with a line so that they produce the most? What are the secrets to that?
Well, I definitely think that you have to treat every patient as an individual. So it's not just about, doing all SRPs. It's not just about doing all prophies. You want to do the appropriate treatment for that particular patient. I think some of the miscommunication on numbers. A lot of people assume numbers are punitive, and I think we need to realize as hygienists that numbers are just a measurement, and that those measurements then can improve. So I think the mindset about numbers and production, it seems to turn off a lot of hygienists, but I don't really think it has to. I think, again, it's if you don't measure something, how can you equate it, or how can you improve it? So I think production is kind of the result. Those are numbers, but it's not good or bad. They're just numbers.
And if you've got the diagnosis, the Codiagnosis is good, right? Because we know the stats are that everybody has periodontal disease, right? If you really measure it. So not that unless you're in this Beverly Hills town where everybody's got perfect teeth, which we don't, right? We're not. So at the end of the day, it really comes down to diagnosis. And if you're diagnosing better and you're communicating better and you have the education and the confidence that taking care of that is going to result in better outcomes, then the production is going to take care of itself. It's just a side effect.
Yeah, we developed a periodontal guide for staging and grading and treatment. And we've been using it for abuse in our office, and it's really been amazing. And you're right, it's taken the onus off of, is it a prophy? Is it SRP? How many prophys are you doing? How many surgeries are you doing? We've been using this little guide with our doctor. So when he comes in to do the exam, we ask him, so what stage do you think this patient is? How much bone loss is there? How much bleeding was there? Is there any bleeding or bone loss? Oh, they're healthy. They could be a prophy. Or actually they have gingivitis. They're not a prophy or SRP. So we're having this conversation in front of the patient and explaining to them this is our updated guidelines, and they feel like we're state of the art. They're getting the best possible care in our hands. They see us co-diagnosing with the doctor, and it's taking it off of how many prophies, how many SRPs, and it's just making it, whatever it is, it's the best thing for the patient.
But don't focus on the numbers, just focus on doing the right thing. And again, I said this, hygienists are in a unique spot where doing right by the patient actually turns you into a powerhouse producer.
Right.
Yeah.
So that's it. You just need the support and the education around that. So this is great points. Thank you so much for this video. And I think a lot of hygienists around the country are going to enjoy watching your tips on how to become powerhouse producers. So thank you very much.
Thank you, Amol.